welcome. Thank you so much for being here so quickly with a quick turnaround of the invitation. So today we will address questions on H5 Avian Flu detected at Wastewater Sampling Site on Oʻahu. Please welcome Dr. Sarah Campbell, Hawaii State epidemiologist.
Thank you. Thanks for all being here today. So the Hawaii Department of Health is investigating possible sources of H5 avian influenza, which has been detected for the first time at the Wahiawa Wastewater Treatment Plant, a Honolulu City and County-run facility. The sample was collected on November 7th, 2024 as part of routine testing performed by CDC's National Wastewater Surveillance System, also known as NEWS. DOH received and announced the result on Tuesday, November 12th. Wastewater sampling is routinely performed across Hawaii as part of ongoing surveillance for infectious diseases, including avian influenza. H5N1, also called highly pathogenic avian influenza, or H5, and it's called that because of its effect on certain type of birds, is one type of H5 avian influenza. Whether this detection is H5N1 is unable to be determined from wastewater testing. The wastewater testing provides a signal for further investigation to determine whether this detection is H5N1 related. And it gives us an opportunity to reinforce prevention measures, particularly among people who are at increased risk of exposure. H5N1 has been spreading among birds and mammals, leading to a nationwide outbreak on the mainland US. Human cases have been reported among those working closely with infected animals. There's no evidence of sustained human-to-human transmission of H5N1 in the United States, and illnesses among exposed workers have been mild. To date, Hawaii is the only state without H5N1 avian influenza detection in birds or animals. There are no reports of human or animal H5N1 cases in Hawaii at this time. Even if H5N1 is found in our state, the overall risk to the general public in Hawaii remains low. DOH, in partnership with federal agricultural and wildlife partners, will continue to support further investigation, prevention, and public health surveillance efforts. While the current risk to transmission to Hawaii residents is low, DOH encourages residents to follow these best practices when around animals or when consuming animal products. In general, do not touch birds, livestock, or wild animals that are sick or dead without personal protective equipment. Residents are encouraged to report sick pets to their veterinarian. In addition, please contact the Animal Industry Division at Hawaii Department of Agriculture at 808-483-7106, Monday to Friday, 7:45 to 4:30 p.m., or 808-837-8092 during non-business hours and holidays to report multiple or unusual illnesses or deaths in poultry, livestock, or wild birds or animals. Do not touch or consume raw milk or raw milk products, especially from animals with confirmed or suspected avian influenza. Pasteurized milk products are safe. We do ask that you contact the Department of Health without delay at 808-586-4586 if you develop symptoms of avian influenza and have been in close contact with sick or dead animals. Symptoms of avian influenza may include fever, cough, sore throat, and conjunctivitis. Antiviral flu treatment is available and recommended as soon as possible for people with suspected or confirmed avian influenza. And I will take questions.
So where are you at in the investigation of the source?
So the next step really is to see if we have persistent detection of H5 in the wastewater from this treatment plant or from any others in the state. Right now we're looking at a single detection, but we have collected additional samples from the Wahiawa Wastewater Treatment Plant working with the county, and those will also be tested through the NEWS program. Our state lab is also able to perform additional testing if needed to try to better localize where it's coming from.
In your experience, what would cause a detection like this?
There can be a number of potential reasons why we would have a detection. When we think about the ways that if this were H5N1, if it were to come to Hawaii. It would either be through wild birds, which fly from other areas where there may be infection. It could come from people who've been to other areas with infection and get infected and come back. We have heard that some human infections have been asymptomatic, so that's also possible. The third possibility would be agricultural animals, but we think that's unlikely because of the strict controls that are in place for agricultural animals coming into the state.
Could it be ingested through mainland products? It's like eggs that are being imported here, and say we eat it, and would that
So it's a great question. Can H5N1 be introduced here through agricultural products? We do know that it's detected in high concentrations in milk, particularly raw milk. Pasteurization of milk does make it safe to drink, but it doesn't necessarily remove all the viral particles. So another possibility is that there's some introduction of contaminated milk that was pasteurized, but we'd still pick up some signal of H5N1.
So you talk about milk, but is it like in chicken products or eggs, since it's a bird disease? So because chickens are so severely affected, usually disease on poultry farms is found quickly and measures are taken so that those products are not sent out. So we don't think of those products as being a likely source of infection, but that would be something to follow up with the Department of Agriculture for more details. Can you talk about how you're working with agriculture and the city to on these cautions and testing?
DOH is working closely with both the Department of Agriculture, specialists from USDA and Wildlife, and with the city and county now with this detection to plan for the possible introduction of H5N1 in Hawaii. Now keep in mind again, right now this detection of H5 could be H5N1, but it also could be another type of avian flu virus that may not have the same impact. So that's one of the questions we would like to solve. If we continue to see that signal, then we can look at where it's coming from and try to identify a source. But we've been working together to plan for the possibility of H5N1 detection, and that's been through regular meetings and looking at preparedness for educating farm workers, for educating people about what to do if they see sick or dead birds. And so that's been an ongoing effort to work together on planning for that possibility.
So is it inevitable, like it's just only a matter of time?
It's very hard to say. And what we've seen in other jurisdictions, some jurisdictions have had detection of H5N1 in wild birds, for instance, but haven't yet seen it in other types of farm animals. And it's not clear why. So for some states, they've had detections for a couple of years without seeing an impact on farms. So there's a lot that we still don't know about the virus.
But you're concerned enough to hold a press conference on it?
Certainly, it's been a topic of interest across the U.S., and part of why is more so than the impact on people who so far have had relatively mild illness. This can have a big impact on agricultural animals. So for instance, if cows are infected, they can get mastitis, and their milk cannot be used for human consumption. If a poultry farm is infected, then the entire flock has to be culled. So that can have a big impact on agricultural operations. So there is definitely a cause for concern in that regard. For people, we worry about lots of people being exposed because of the possibility of the virus mutating. The virus we've seen so far in the US has not caused severe disease in people. It's primarily caused conjunctivitis, meaning redness and itching of the eyes, and then some mild upper respiratory symptoms. But if the virus were to mutate and more easily infect people or cause more severe disease in people, that would be a concern. So the goal on the human public health front is really to minimize exposures of people to the virus.
Are you hypersensitive in light of COVID too, right? I mean, and how that kind of...
Clearly, having survived one pandemic, we hope to not have another. So a lot of this is trying to look forward and prevent a type of illness that could spread among people.
When you hear avian flu is in Hawaii, that can cause a concern to some people. What's your message to the public about this instance?
My primary message to the public would be that if we do detect avian flu, the H5N1, in Hawaii, the risk to people in the general public remains low. The people that we would focus the most on with such a detection are our farm workers, people who may have more direct exposures with animals, whether they're domestic or wild, and making sure that they have the education on how to protect themselves and their animals.
You know, when you talk about the public finding dead animals, are you talking wild birds? Are you talking about like pigeons and the feral chickens that are everywhere here?
We do know that chickens are quite severely impacted by H5, so finding a dead chicken, one dead chicken might be hard to assess, but if you see multiple dead chickens in an area, that would definitely be a signal to report, and we could collect those for testing. So we do have in Hawaii a lot of free-range chickens out there. So that may be one thing we can watch. If you're seeing die-offs of feral chickens, be sure to call or report. Other birds can be affected, but not all of them show many symptoms if they are infected. So some birds might get infected and not look sick.
And what about, say, your pet cat, pet dog, bringing a dead bird home? Is that cause for concern, or should we try to keep our pets away from birds in general?
I think at this point we don't have enough information to say, you know, are we seeing H5N1 here and circulating? That's what we're trying to establish. On the U.S. mainland, some other animals have been impacted, especially around farms. Cats were noted to get very sick and can die from the virus. Usually the cats were drinking the discarded milk from infected cows. So there are some reports of that, but it's too early to say that we have that concern for our pets in Hawaii. And really it's not going to be every pet, it's really primarily farm animals.
You said you can't get definitive results from the wastewater testing?
So the wastewater testing tells us H5. The H5 is the hemagglutinin antigen from the influenza virus. So it's a type of bird flu, but there are actually many different types of flu. There's the H5 and then there's the neuraminidase. So you'll hear like H5N1, there's also H5N2, N3, etc. So there's a lot of different H5 viruses. So this tells us it's some kind of H5 avian flu, but it doesn't tell us for sure that it's H5N1.
But the test won't show that.
The test that was done will not show that. The routine testing done through news.
Okay.
Now, our state laboratory is looking into whether additional testing could help us to get more specific, but that's still in process.
And when do you expect results for that?
I don't know at this time. We would have to detect it again, first of all. So.
When are more tests going to be done for that? What do you want?
We've done more collections. If we do detect H5 again, we will attempt to see if we can get more specific information. It's not guaranteed that we would, because it depends on how the quality of the sample, you know, how much virus was actually in the sample, but we could attempt that.
What else do you folks test for?
We test wastewater for a number of pathogens, so not just for H5, but for regular influenza, A and B. We test for respiratory syncytial virus, for COVID-19, and also for some other organisms like Candida auris, so things that might cause healthcare-associated infections.
Does the state have a plan should this virus end up spreading here?
If we do detect H5N1 in Hawaii, we will be working very closely with agricultural partners in particular to look at biosecurity on our poultry farms and other agricultural settings where an introduction could cause harm. So that would be, I think, a primary priority. We would also want to make sure the public has accurate information about their own risk, remembering that H5N1 at this time does not pose a high risk to the general public. But it is important to be aware of what symptoms might be, to seek care if you do develop conjunctivitis or respiratory symptoms after having contact with, say, a wild bird.
We're good.
Any other questions?
Last question. What do you consider contact with a wild bird?
So you don't want to touch a wild bird with your bare hands. Ideally, make that call first and don't try to collect it yourself without talking to the Department of Agriculture. If you do need to contact a wild animal, you want to be wearing disposable gloves, an N95 type of mask, and protection so you're not getting germs on your clothes, as well as eye protection.
Sorry, and it is super contagious like the regular flu or?
So as I said, it's very contagious among birds. For people, though, we haven't seen a high level of contagiousness. The people who have been infected have been people who work very closely with farm animals. And so they're getting very high level exposure in very close quarters with animals that are sick. For people that are just going about their daily business, the risk would be very low to catch this virus.
You said regular testing is done. When's the next test? Or how often is the testing at the wastewater plant?
It's collected twice a week, so I believe the next test has been collected, but it typically takes about a week for those results to come back.
And how is it transmitted? Is it contact or airborne? Do we know?
So like other flu viruses, it can be spread through respiratory droplets and other smaller particles. And so it's similar to what you think of for seasonal flu or COVID-19 in terms of its ability to spread from person to, from animal to person. But because the virus doesn't easily infect people, we don't see that kind of risk with person-to-person transmission. So it's really, an example is people who are going into work with sick birds once an infection has been detected on the mainland. They're having to catch those birds while they're flying around. The feathers stir up those viral particles and it can be inhaled. And that's why those people are advised to wear personal protective equipment when they're dealing with those operations.
Thank you. Any last questions?
Do we have access to the H5N1 flu vaccine?
So CDC has done preliminary scientific work to make development of a vaccine against H5N1 possible if needed. Right now, the number of people getting infected with the virus and the types of symptoms they're having is not severe. So there hasn't been a demand to push forward with that, but the legwork has been done so that if a vaccine were needed, they could move to that. So at this time, there's no vaccine in production. Seasonal flu vaccines, though, are still a good idea because there's one thing we want to prevent, and that's having people catch H5N1 and seasonal flu at the same time and have the two viruses be able to meet and mingle in one person. Then you accelerate potential evolution of the virus. So getting your seasonal flu shot is still a good way to prevent those kinds of concerns from H5N1. Thank you.
Thank you.
Thank you, everybody.
Thank you.
Thank you.